I'm Sal Rosselli, and I work for you, okay? And welcome to our 6th Annual Leadership Conference.
The reason of why I joined NUHW,
I wanted to form a union in my hospital because I wanted to ensure that the staff was treated fairly.
The reason I joined the union at West Anaheim, the wages aren't comparable to other hospitals in our area. We just want to be paid fairly.
we're afraid of our management. They use their authority over us.
One moment I heard management had suppressed my work review to a lower score, and actually that's the point where I just had enough.
I was afraid that we would never see a raise again. I was afraid that we would never get adequate staffing.
I have no idea about union. I never have experience. I never be a member of any kind of union.
Coming from an African-American background, I was taught to be skeptical of unions.
You hear things about unions and a lot of doubt about joining, not sure if it's really beneficial for you.
Forming a union was a scary concept because we were worried what is going to happen to our jobs, how is management going to retaliate against us.
Originally, I was terrified. I thought management was going to come after me.
The common fear is retaliation.
People will tell you that you can get fired, but that is not true. It is a law that you have the ability to organize in this country.
The company will put a lot of pressure on you to try to talk you out of going union.
And then they will give us all the promises of the raise, the benefit and everything.
The company said that if we gave them 1 year, they will fulfill everything the union could do for us.
They did the same thing. They promised to give us a wage. They promised to get us a better benefit, but they haven't done anything.
And I can't believe them.
So I'm like, no, I don't take their promises anymore. I can't trust these guys anymore.
And we decided we need to just go in on all this. We need to move forward because this is what's right for ourselves and our families and our jobs and ultimately our patients.
And I had to do something about it. And that's when I started organizing and getting really involved.
I knew I was all in the first time I went to the first meeting.
The moment that changed my mind about NUHW was when I found out how much they demanded their union members participate.
NUHW is run by its members. We make the decisions, we decide where the money is going to go, we decide who we're going to support politically.
Most, if not all, of the decisions are made in consultation of the members.
We're the union. We are the union.
We're all in this together, and we fight together.
We are a big, strong group of people who are willing to march to CEO office and demand our rights.
And I couldn't wait to get upstairs and put a big yes on that ballot.
So when we moved forward with the union, we found that all of the threats that management had made about what would happen if we had a union, none of that came true.
You're gonna have to go through the experience and the feeling just like mine, but then look at me now. I'm not afraid anymore.
We have now a good platform to build something really good where we work.
The beauty of this union is we do it together, we build it together. You don't do this alone.
I'm Andrew Fernandez, and I joined NUHW.
My name is Barbara Buckley.
My name is Chris Malonzo.
My name is Monique too.
My name is Jeannie.
I'm Carrie Helgeson, and I joined NUHW.
And I joined NUHW.
I'm David Hampton, and I joined NUHW.
Now, the video we just watched is an important reminder that our union has the power to inspire. The power to inspire people to work together, to improve their lives, to improve healthcare in this country, and to achieve the American dream. A few of the folks in this video that we just saw have already won contracts with raises and job protections that never could have been achieved if they hadn't come together and used their collective power. We know these battles are never easy. Winning them takes unity, determination, and faith in each other. We have to be all in. And when we say all in, we mean more than just putting all of our chips in the center of the table. We mean doing everything we can, sacrificing for each other, working collectively for the common good, to make a difference in our communities and our country. All in means that after a stewards meeting in Orange County, we make calls on behalf of congressional candidates like Gil Cisneros. Because Gil will never vote to cut Medicare or give away billions in tax dollars to corporations. All in means that after a hard week of work in Oakland, we go door to door telling voters to elect Jovanka Beckles to the State Assembly. We know that Jovanka is all in on making California the first state with universal health care, right? And frankly, Jovanka's opponent is a Democrat, but she's part of the establishment, and her opponent is not for universal health care. There's a reason why I'm using politics in these examples, because the people who win elective office have influence over our employers' purse strings. They have influence over which judges hear our disputes. They have influence on whether it becomes easier or harder to join a union, and influence over whether the United States joins every other industrialized country in this world in making healthcare a universal right. And frankly, the people we elect to the House of Representatives in November will help determine whether we restore our democratic principles or let them slip away forever. Politics is union business. Politics is certainly NUHW's business, and that's why we're going to be talking a lot about it this weekend. I want to quickly review the agenda that's in your folder. First of all, how many of you took part in the education courses we did yesterday? How were they? I'm just so excited and happy to announce that NUHW has launched our own continuing education program online to further support our members' professional development. If you go to nuhw.org/CE, you'll find the first of our continuing education classes. These classes, which are free for NUHW members, are targeted to help folks in dozens of job classifications get the units that they need to help keep up their licenses and certifications. About an hour from now, our longtime friend, Dr. Paul Song, will talk to us about why we must achieve healthcare for all. Paul is a former director of the Courage Campaign and one of our staunchest allies. At the end of his talk, we're going to facilitate table discussions to get your thoughts and your ideas on how to improve our training and education program around this very complicated issue of healthcare reform. So much of our work is about using our collective action to force employers and politicians to do something that they don't want to do. Later this morning, we'll have a panel of teachers who did just that in states where teacher strikes are illegal. This afternoon, you'll be participating in quality workshops led by the most dedicated and talented staff in the labor movement. And then at dinner tonight, we're going to have the honor of hearing from a living legend, Dolores Huerta, co-founder of the United Farm Workers Union. Tomorrow morning, my favorite assembly member, Phil Ting, will welcome us, and we're excited to have State Senator Kevin De Leon talk to us and answer our questions. Kevin is running for the U.S. Senate this year against Senator Dianne Feinstein. Unfortunately, Senator Feinstein is not going to be with us here this weekend. We really tried, and she's doing some very important work right now around the Supreme Court hearings in Washington, D.C., so we offered to have her come to us by a video, but it just didn't happen. Then tomorrow, like right after we break, our union stewards, our elected stewards, will then vote our union's endorsement for the United States Senate. Also tomorrow, we're holding a forum on immigration policy. The forum will include several immigration experts, as well as Veronica Aguilar, an undocumented woman who recently was detained by immigration authorities for 7 months. Before the forum, we'll hear an address by Ashley Tabador, a Los Angeles-based immigration judge. Judge Tabador is president of the National Association of Immigration Judges. That's the union that represents those folks. And because she's president of the union, and only because she's president of the union, Judge Tabador is able to speak publicly about her experiences as an immigration judge. Judges are not allowed to speak publicly about these issues, so I imagine that her talk will be most enlightening. When we gathered together at this time last year, we spoke a lot about our union's history. In particular, our decision to break away from SEIU and to form NUHW 9 years ago. Those were very hard times. The first 5 years were all about the very survival of our union. But we held together because we share certain common core values that SEIU had abandoned. We believe in union democracy and that a union must be held accountable and led by its members. We believe that worker power is the foundation for a just society and quality patient care. And we believe that healthcare is a human right and that achieving parity for mental health care is one of the most important civil rights of our time. When we talk about going all in on politics, we're looking for candidates who share these values and will advance them in office. We're not naive. We know that we won't have a kindred spirit in every political race. We know that we can't let the perfect be the enemy of the good. But when it comes to knocking on doors or making phone calls to voters or contributing to COPE, we're trying to further our values. And we're trying to make this state and this country a better place for working people. Volunteering to help elect politicians is not a cynical exercise. This is not about I scratch your back, you scratch mine. We're trying to elect principled people who share our values and who will fight for them. Not because they owe us a favor, but because they know it's the right thing to do. Those are the allies we need. Those are the people who won't flinch when it comes to getting tough. And folks, right now, as a country, we need those kind of leaders more than ever. And something else that we need more than ever, universal health care, right? And we also need to make sure that Gavin Newsom is the next governor of California because we won't win health care for all without him, right? How many folks were here at last year's Leadership Conference in Anaheim? Let me hear you. We hosted the first governor's debate. Remember that?
Let me acknowledge the development of this union as a model union, a worker-led union. You have been at the intersection of patient care, public policy, also political activism. And trust me, that's not lost on me. I was just over there with some folks from CPMC. I saw in different incarnations that activism firsthand, and the work in Oakland at Children's Hospital, down here at Fountain Valley here in Orange County, and the work, of course, the epic struggle over 5+ years at Kaiser, the work you're doing at USC, which I was introduced to last night. This is an example, I think, of a remarkably enlightened approach to bottom-up leadership that is demonstrable in terms of your organization of this first candidates forum, but also in bringing to the fore the most critical issues of our time, and those are the issues of healthcare, mental health, issues of parity, substance abuse, and of course the fundamental issues that define all others, immigrant rights and workers' rights.
You've said that you support universal health care and see a single-payer system as the best way to achieve that. A state-level single-payer system would require the state to cover costs for all Californians, including those who currently receive health coverage from private insurers. How would you propose paying for such a plan?
I think there's a lot of mythology about the cost of single-payer, that somehow we're adding on top of an existing multi-payer system. when in fact it's about reallocating existing resources and using them more effectively and more efficiently by replacing the current multi-payer system. A single-payer system drives down the cost of healthcare, drives down the cost of prescription drugs through economies of scale, and provides a more effective, efficient, and universal access for those that are uninsured. Single payer is the way to go to reduce costs and provide comprehensive access.
Our union that day got over 200 press clips all over the country, and actually outside of the country. So healthcare for all isn't just a core value, it's common sense. It means more paying customers for our employers, and it means that healthcare benefits would be off the bargaining table. You can't bargain over a civil right. Imagine the raises and other benefits that we can win if healthcare costs are not an issue for our employers. To understand the importance of politics on the nuts and bolts of winning good contracts, let's look at what our Sodexo members were able to accomplish this year. Decades ago, our EVS and dietary workers in Northern California won good living wages. And they are employed by our hospitals, and they enjoy the same health care and retirement benefits as nurses and our technical workers. These same workers that do these jobs in Southern California, it's a whole different story. They're subcontracted to international for-profit corporations like Sodexo. These workers make barely above minimum wage, have no health care for their kids, and no retirement benefits at all. Last summer, we met with our Sodexo leaders from 5 Southern California hospitals. We pledged that if they were willing to organize their co-workers to fight, we would dedicate the staff and other resources needed to win. Our Sodexo members marched on their bosses and walked picket lines, and we waged a powerful social media campaign.
Aunque trabajo para 2 corporaciones muy grandes, Sodexo y el hospital para el cual trabajo, mis compañeros y yo tenemos que colectar botes para ayudarnos.
I'm usually recycling and collecting cans before and after work. Financially, things are tough. It's hard to make ends meet unless I'm working overtime and long hours, usually 16-hour shifts. I work for Sodexo. I make $12.25 an hour. On a weekly average recycling, I get $35.
I collect cans because even though it's just a can, but it'll bring $1, it'll bring a penny, it'll bring something, whatever helps out. Basically, all my coworkers are doing the same thing because of the low wages that Sodexo is giving us.
Con los $80-90 que obtengo por la venta de los botes, pago el bill del agua o el bill de la luz.
I recycle and I save cans to pay for gas and groceries or anything else that me and my kids might need. Most of my coworkers recycle also because our wages are very low.
Las cosas en mi casa económicamente son difíciles a pesar de que somos 2 personas que somos los proveedores.
I take care of my parents. Both are elderly, they're in their 70s. But with the wage that I'm getting right now, which is low, it's not sufficient for me to cover my personal needs and for my parents.
I really wish I didn't have to recycle to make ends meet.
Estoy pidiendo un contrato que me dé respeto, un salario justo y un beneficio médico digno.
I wish I didn't have to collect cans, but I also wish that Sodexo will pay us fair wages.
While we have not yet won it all, I'm proud to report that this year we won raises of up to 42% for our Sodexo workers at 3 hospitals. The workers at Fountain Valley, Tenet Hospital, Fountain Valley in Orange County, and Los Alamitos, and Lakewood Medical Center in Southern California, all Tenet hospitals that subcontracts to Sodexo. At USC's Norris Cancer Center, our Sodexo members got the university to fire Sodexo and bring them in-house. Overnight, our members there got $3 an hour raise employer-paid retirement contributions, health care for their kids, and tuition reimbursement for their kids that go to USC. Please know that politics also played a key role in winning these contracts. A 2016 state law increasing the minimum wage, which we supported and worked hard for, improved our leverage in winning even bigger wage increases with these hospitals. And at USC, a former state senator who is now on the Los Angeles City Council, a great friend of ours, Gil Cedillo, intervened on our behalf to bring the Norris workers in-house. We won with our collective power, but our political clout amplified that power. And that's why about 60% of our Sodexo members signed up for COPE after ratifying their contract. Sodexo leaders, please stand. I want to ask the Sodexo leaders to please stand. Can we have a little light? Light? No lights? Yeah, Sodexo leaders, where are you? One more time, Sodexo leaders, stand so folks can see you. You know, our Sodexo folks won a trailblazing victory, but it's important to note that we represent other low-wage workers needing contract improvements this year. You know, we're gearing up for negotiations at 3 North American nursing homes, as well as Mission Neighborhood Health Center and San Francisco Nursing Center. And just Thursday of this week at the Sequoias down in Portola Valley, about 30 miles south of here, we won a new contract with 16% wage increases over the next 2 years. Let's recognize our clinic and nursing home workers. Please stand. One of our biggest political victories came a couple of years ago, led by our members who work at Alameda County jails. We used our power to get the Alameda County Board of Supervisors to cut ties with a contract that had no bid contracts to provide healthcare services for the prisoners for decades. Our members at Glendyer Detention Facility and Santa Rita Jail kept up their hard work this year and pressured management to hire more staff and won contract language that fixed scheduling problems for our nurses. Let's hear it for our nurses at Santa Rita and Glendyer. Kindred, a national for-profit corporation, runs long-term acute care hospitals. It's a critical component of our healthcare system, but Kindred is notorious for underpaying its employees. They'll pay just enough to get people hired, and then they'd rather people leave than get paid for what they're worth. But we're working to change that. We're negotiating contracts at Kindred facilities in Westminster, Brea, and San Leandro. At Brea, our members had a successful informational picket line just last week, and on the line voted unanimously to authorize a strike. And this year, we won an important first-time contract at Kindred San Diego. Management agreed to settle 1 day after our members authorized a strike. The agreement there will increase wages between 9% and 24%, with long-term employees finally getting the raises they deserve long ago. Let's hear it for our Kindred leaders from Southern California. Kindred folks, please stand. Kindred. There are 2 established public sector hospitals in our union. That means that they are impacted by the Janus Supreme Court ruling that I'm sure you've all heard about, which lets public employees avoid paying dues. Want to know how many of our members at Hazel, Hawkins Hospital and Salinas Valley Memorial Hospital have opted to stop paying dues? Any guess? 0. That's right, 0. And you know why? It's because they have great leaders who have won good contracts and enforced those contracts. You know, unfortunately, our Salinas leaders didn't make it this year, but Hazel Hawkins is in the house. Let's hear it for our Hazel Hawkins and Salinas members. I'd also like to recognize relatively new NUHW units, RadNet, the nation's largest imaging company. We're the first union in the country to organize RadNet, and this company has been pulling out the stops to avoid bargaining with us and avoiding the other employees joining our union. We're also bargaining first-time contract for Dominican Hospital professionals in Santa Cruz. That's our union's first Dignity Hospital. Let's hear it for our Dignity and RadNet leaders that are here today. Fountain Valley. Fountain Valley is owned by Tenet, the second largest for-profit hospital corporation in the country. Tenet strives to pay its workers as little as possible, but our members decided they wouldn't stand for it anymore. They joined us just last year and won a first-time contract with raises up to 15%. Our Fountain Valley members also showed great solidarity with their Sodexo co-workers. They marched together on picket lines demanding a fair deal for them. Let's hear it for our Fountain Valley leaders and ask them to please stand. We have leaders here from San Mateo County who work at Seton Medical Center and Seton Coastside. You may have heard that the owner of these hospitals, called Verity Health, is in financial trouble and looking for a buyer. We've already met with state officials and told them they need to hold Verity accountable to its agreements and provide strong oversight over any sale. The support of our Attorney General, our state senator, and Assembly Member Phil Ting is fundamentally important for us to win protection for our members at these hospitals. Let's hear it for our Seton and Seton Coastside members. Ask them to please stand. West Anaheim is the first prime healthcare hospital we organized into our union. And the story there is similar to Kindred and Fountain Valley. Prime is another for-profit corporation that does not pay competitive wages, even though the hospital turned a $28 million profit last year. So far, they've offered us a 16% raise, but that still doesn't bring our members up to union scale that they deserve, so we're fighting for more. We've already had a one-day strike, and next month, folks, we're preparing to strike for a week. We've also gotten great, tremendous support from political leaders, elected leaders in Orange County who want their constituents to be paid fairly. Let's hear it for our West Anaheim members, and I ask them to stand. Sutter Health, the largest nonprofit hospital corporation in Northern California. It includes California Pacific Medical Center and Sutter Visiting Nurses Association of Santa Cruz. It was a mixed year at CPMC. We narrowly lost a big residual organizing election there when Sutter lied to the workers and convinced them that their jobs would be in jeopardy if they joined us. On the plus side, our nursing assistants won a tremendous arbitration ruling requiring Sutter to work with us to improve staffing. We're currently negotiating over the opening of a new Sutter hospital in San Francisco, and we're now in bargaining for a new contract for Sutter Santa Cruz professionals. I ask you to give them a round of applause and ask our Sutter workers to please stand. Our members at Keck USC Clinics, who just joined us last year, won their first contract in April, and we continue to win elections clinic by clinic and department by department. And we're now bargaining jointly for more than 1,000 Norris and Keck hospital workers. We're going to win increased wages and increased retirement benefits within the next few weeks. Let's hear it for our Keck USC and Norris Cancer Center leaders. Please stand. At UCSF Children's Hospital. This is one of our greatest success stories, folks. You know, last year we won a good contract for our longtime service workers, about 300 folks that have been in our union for literally decades. And then last year, we won a first-time contract for recently organized tech and business office workers at Children's. And then this year, we won a first-time contract for over 200 newly organized professionals at the hospital and won a defined benefit pension plan for recent hirees. I don't know a union in this country that's winning defined benefit pension plans these days. So now we represent 1,200 workers at Children's Hospital in Oakland. And that's a clear demonstration of their appreciation for the role that politicians play in their future. Over 37% of those 1,200 members are now enrolled in our voluntary COPE program. Let's hear it for children's workers. Please stand. Lights, please. Children, stand. Where are you? You know, our growth at Children's and KEC, similar situation at KEC, is a testament to our members demonstrating what we can achieve as a union, and that the more we grow in your hospitals, the more we can win. So, I ask you to take the time today to read and fill out a leaflet that's at your seat about residual organizing. It's a survey. You can help us grow. So sometime this morning, please fill that out, and we'll take it and follow up and do what we did at Children's and what we're doing at KEC USC today. You with me? Okay? And just leave them on your table. We'll collect them at the break. Let me talk about the Providence St. Joseph Health System now, which, in my opinion, has evolved into our most anti-union employer. We had to win unprecedented legal battles over the last 2 years just to get them to the bargaining table at Queen of the Valley Medical Center in Napa. They've laid off more than 24 of our members at Santa Rosa Hospital. And in bargaining over the effects of that layoff, the CEO admitted that the sole reason for the layoff was to increase their already excessive profit margin. Providence St. Joseph operates our hospital in Petaluma Valley. Our members there are continuing to document instances about understaffing. At Providence St. Joseph's, way up north in Humboldt County, we had a major rally there this month with the California Nurses Association to address the chronic understaffing at St. Joseph Hospital in Eureka and Redwood Memorial Hospital in Fortuna.
We will not be divided. We are coming together, and we are going to fight for what we feel is right.
I'm personally here today to support my coworkers and bring attention to the fact that our patients aren't getting the care they need.
Sometimes, mostly of my coworker, they're gonna take another second job because it's not enough.
What we make now is not enough, and they want to give us even less.
So for us, it is important to have this simply so we can survive.
I'm here because I believe that with this contract that we're fighting for, it'll make it better for all of us.
Two days after that rally, the hospital laid off more than 24 more caregivers. Our members at Providence Tarzana in Los Angeles have been working without a contract since January. They held their first strike ever, a one-day strike, earlier this month seeking to win fair wage increases. Our leaders at Providence Tarzana, are meeting next Thursday to decide what steps to take in this contract campaign. And now, we just recently learned that Providence St. Joseph wants another merger with an anti-union company called Adventus, which has 0 union members. This is going to be a multi-year statewide fight, and we're getting to launch a statewide campaign. And please hear that this is a campaign that we cannot win without the support of our Attorney General and other political leaders. Our Providence St. Joseph leaders are meeting tomorrow afternoon to launch this fight. I ask them to please stand now and be recognized. Providence St. Joseph folks, please stand. Many of our newest members are in the mental health field. Richmond Area Multi-Services in San Francisco, also known as RAMS, Elk Grove Unified School District in Sacramento County, Janus of Santa Cruz, HCA Mission Oaks in Santa Clara County. These are all mental health clinicians and drug treatment workers that have joined our union over the past year. Last month, we won a first-time contract in Elk Grove. And our members at RAMS and Janus are both publicly funded nonprofits, have been doing great work building political support in their counties, building the political power necessary to win more funding for these nonprofit organizations so we can improve both wages and patient care. You know, I want to share a recent win that absolutely demonstrates that politics is union business. RAMS gets 70% of its funding from the city of San Francisco. We asked our newly elected mayor there, who is not yet a friend of our union, to add $500,000 to the $11 billion budget of the city for these workers that are grossly underpaid. And these folks provide behavioral health care for San Francisco school kids. She rejected us, flat out. Not because the workers don't deserve it and she doesn't care about the kids, but because they're in a union, right? And she's not yet our friend. So these workers, we collectively went to the Board of Supervisors, and there are 11 of them in San Francisco, not like most counties. And we got commitments from 8 of the 11, enough to override a mayoral veto for the $500,000. So folks, Mayor Breed has now found a way to meet our funding request. Now that's why politics is NUHW's business. Let's give those members from RAMS a hand, and Elk Grove and Janus and HCA, please stand up. Last but certainly not least, it's a big year for our members at Kaiser Permanente. Well, our optical contract expires next year. Our contract's covering 4,000 professionals, Berkeley lab workers, and mental health clinicians all over the state, expires a week from tomorrow. 3 years ago, we settled contracts with Kaiser after a 5-year war. I'm reminding you that that settlement was mediated by our friend Darrell Steinberg, who had just termed out as president of California's Senate. It's another example that politics is NUHW's business. The 5-year war, led by scores of selfless leaders, many of them are in this room today, also resulted in Kaiser committing to us to work collectively, collaboratively, to make Kaiser the best place to receive mental health care and the best place to provide mental health care. After that long struggle, the president of Kaiser came to us and said, "We can never go through that fight again." Well, friends, our members are ready. If Kaiser doesn't walk their talk, we're ready to go through that fight again. I predict that next year when we come together, we'll be reporting to you that NUHW won the best contract ever with Kaiser Permanente. Let's recognize our Kaiser leaders here today. Please stand, Kaiser leaders. One more thing. Earlier this month, we won our first election for mental health workers outside California. We now represent workers in Kaiser, Hawaii. And one of our newest leaders flew across the Pacific to be with us here today. Andrea Kumura, where are you, Andrea? Welcome, Andrea. So folks, we've won some great contracts over the past year, and we have the chance to win even better contracts and organize far more workers in the coming year. People all over the country, I believe, have started waking up to the fact that workers aren't getting a fair deal. Teachers went on strike in states where it's illegal to strike, and they won. In Missouri, voters overturned a law that made union dues optional for all workers, both public and private sector, because the voters there knew that it would lead to lower wages. People are seeing that unions are the solution to lifting workers out of poverty and restoring the American middle class. And folks, electing pro-worker politicians is critical to making it happen. We're at a moment where there is real opportunity and real danger. If we're all in, we can force USC to bring in-house every last one of the Sodexo workers. We can win a contract, big raises for our Keck and Norris cancer members, and when we win that contract, we can organize hundreds of unrepresented Keck USC workers into our union. If we're all in, we can win great contracts at Providence St. Joseph next year, and that will set the stage for organizing thousands more Providence St. Joseph workers throughout California. And if we're all in, we can win another landmark contract for our Kaiser members. We can secure our future to have mental health care in this state on parity with medical care, and we can cement ourselves, NUHW, as the union for mental health care workers in other states. If we're all in, we can elect allies, flip the House of Representatives, pass health care for all, and establish ourselves as a political force for workers and patients alike. So let's do it. Let's work hard. Let's sacrifice for each other. Let's go all in together. All right? You with me?